Hi, I'm Peter Carlobos and I will be showing you how to perform the basic ENT physical examination. Hi ma'am, ako si Intern Peter Carlobos. Ang saan imong pangalan ma'am?
Carlo Rosales.
Pag physical examination ko sa imong ears, nose, mouth, and neck, okay ra ma'am. And when we will be using mga instruments that we will be inserted into those areas, if na kay questions or you feel uncomfortable during the exam, you can interrupt me anytime. And after every examination, I'll just verbalize the findings ma'am. Before we begin the examination, make sure that the head mirror is opposite to the drop light and the drop light is behind the one side of the patient. Sit with legs on one side and parallel to patient's leg so that you do not straddle the patient. Make sure that you can see clearly through the hole of the head mirror. Lastly, make sure you have performed hand washing or applied disinfectant on your hands and wear clean gloves. Examination of the ears. Magsugod na ta sa ear exam. Ma'am, okay ra na ako ikapo ng imong tunggan? We will start inspecting the ears externally to look for lesions, masses, infection, hematoma, or signs of skin cancer. Pull the auricle back and look for any discharges and patency of the ear. Ingin ko ma'am kung kuan sakit ma'am ha? Then palpate the tragus for tenderness. We will also inspect the back of the ears for any lesion. Then perform on the other ear. Otoscopy. Okay ma'am, I will be inserting this otoscope into your ears. Let me know if you feel any discomfort or any pain upon inspection ma'am ha? Handle the otoscope in a pencil grip position and anchor a finger into the patient's cheek so as not to further push the otoscope inside the ear canal, which might cause trauma to the eardrum. Insert na po ma'am. In adults, push the auricle upward and backward in order to straighten the ear canal. Tantangon na po ma'am ha? Then perform on the other ear. Pikas ng ear. Then explain the findings. For inspection, there are no gross deformities, masses, or discharges noted. For palpation, no tenderness noted on the auricle, tragus, and mastoid area. For otoscopy, ear canal patent not occluded by cerumen, pearl gray tympanic membrane, intact, translucent, with a cone of light directed anteriorly and inferiorly. Tuning fork test. Ang sunod ma'am kay tuning fork test, this is to assess for any hearing loss. There will be 2 tests performed, so we will start with the Weber's test. I'll place this above your head, then tell me if sound is equally heard on both the ears or it is louder on one side only ma'am, okay ha? Okay. Madunggan ba sa both ears or isa ra ma'am?
Sa both, sir.
Okay ma'am, next kay Renee's test. I place the tuning fork behind your ears, then tell me kung mawala na ang sound, then i-transfer na po sa imong dunggan, then tell me if mawala na sa sound ma'am ha? Sige. Sa line dunggan ma'am. Explain the findings. Weber's test equal on both ears. Renee's test, air conduction longer than bone conduction. Next, we examine the nose. Next ma'am, akong i-examine ang imong nose ma'am ha? First, inspect for any gross step-off deformities, lesions, masses, or discharges. Ikapunaan akong imong ilong ma'am ha, ingara ko kung naisakit. Next, palpate the nose.
Clara.
Sige, kani.
Clara po.
Anterior Rhinoscopy. Next ma'am, I will be checking your nose internally. So I will be inserting this into your nose. Let me know if na kayo ma-feel na discomfort or sakit ma'am ha. Sige. Handle the nasal speculum with your dominant hand. Use your non-dominant hand to adjust the patient's head. Use your index finger as an anchor on the patient's nose so as not to further push the speculum, which might cause trauma. Then insert the speculum gently and be directed laterally to avoid touching the sensitive septum. Then open the speculum once you're inside. Inspect the nasal mucosa and turbinates for its color, any swelling, bleeding, exudate, masses, polyps, or ulcers. Check the nasal septum for any deviations or perforation. Once done, withdraw the nasal speculum with blades partially open to prevent pulling out the nasal fibrossae. Then explain the findings. For inspection, no lesions, gross deformities. For palpation, nares patent with no perforations, no step-off deformities, non-tender frontal and maxillary sinuses. For anterior rhinoscopy, nasal septum midline, pink nasal mucosa and turbinates, no discharges, bleeding, masses, polyps, or ulcers. Next, we examine the oral cavity and oropharynx. Next, ma'am, examine ta sa imong mouth and oral cavity. Open niya ang imong mouth, then I will be using a tongue depressor to displace your tongue. Okay, ra, ma'am? Sige, open ang imong mouth, ma'am. Examine all surfaces of the mouth. Inspect the lips for color and moisture. Inspect the teeth if it is complete. Inspect the alveolus and buccal mucosa for color and lesions such as ulcers. Inspect the anterior 2/3 of the tongue, its sides, and the floor of the mouth below the tongue. Then inspect the roof of the mouth and the hard palate. Ask the patient to protrude their tongue. Ipagawa sa atong dila, ma'am. Say, This is to assess mobility of the tongue, elevate the soft palate, and visualize the oropharynx. And inspect the retromolar, trigone, and tonsils for color, exudates, or enlargement. Then explain the findings. For inspection, pink and moist lips, pink oral mucosa with no lesions, pink gingiva with no lesions, complete dentition with no damage, tongue midline upon protrusion, soft palate movable upon saying uvula at midline, tonsils Brodsky scale 0, non-hyperemic or inflamed, pink posterior pharyngeal wall. Next is posterior rhinoscopy. Next, ma'am, I will be inserting this into your mouth together with the tongue blade. If it is uncomfortable, we can stop at any time, ma'am, ha? Sige. Open na to mouth, ma'am. Breathe through your nose, okay? In posterior rhinoscopy, introduce the nasopharyngeal mirror inside the mouth to visualize the oropharynx. Use the non-dominant hand to depress the tongue with the tongue blade, and your dominant hand with a pre-warmed mirror facing upward above the tongue blade. Okay na, ma'am. Then explain the findings. Pink nasopharyngeal mucosa, no masses, lesions, or discharges. Indirect laryngoscopy. Next, ma'am, I will be checking further inside your mouth. I will be inserting a laryngeal mirror. There might be a slight gag reflex, or if it is sensitive, and if it is painful or uncomfortable, we can just stop at any time. Place the patient in a sniffing position. Linta forward gamay and slightly lift up your chin. Then open imong atok mouth, ipagawas ang atong dila. Using your left hand, use your middle finger and thumb to grasp the tongue and your index finger to retract the upper lip. Use your dominant hand to introduce a pre-warmed laryngeal mirror facing down. Insert na nina ko, ma'am, ha? Sige, and then say E. Sige, okay na, ma'am. Then explain the findings. Epiglottis crisp with no lesions, vocal folds translucent, white, crisp borders, with intact vocal cord mobility, no masses or lesions noted. Next, we examine the neck. Next, ma'am, examine ta sa imong neck, ma'am, ha? First, inspect the neck for its symmetry, masses or scars, also for enlargement of the parotid and submandibular glands and enlarged lymph nodes. Assess the trachea for any deviations. Next is palpation. Stand at the patient's back. Ma'am, okay ra hikapon ako imong neck. Sige, slightly flex your head forward. Using the pads of the index and middle fingers, palpate both sides to compare for any abnormalities. Palpate the lymph nodes systematically from the back of the ears, to the front, at the base of the skull, to the chin, then at the midline of the neck, to the sides, then at the clavicles. Palpate for any inflammation, lymphadenopathy, or tenderness. Then, assess the thyroid. Move the trachea to one side and assess for the thyroid size, contour, and consistency. To assess for its mobility, ask the patient to swallow. Sige, ma'am, try pagtulon, ma'am. Then explain the findings. For inspection, supple, trachea at midline, no venous engorgement, bruises, lesions, parotid and submandibular glands not enlarged. For palpation, thyroid mobile, not enlarged and non-tender, no lymphadenopathies. Sige, thank you, ma'am.
Yes, sir.